Hi, my name is Stephanie Klappholz. I am an educator at Mercy Medical Center here in Cedar Rapids. I am the educator appointed to the emergency department. So what does that mean? It means that any new employees, I get to help orient them and show them how to do the job. Nursing also requires a lot of continued education. Once you're never done learning when you're a nurse. So part of my job is continuing that education with our staff and making sure everything is up to date and the evidence matches what we're doing in the ER. So I've had quite a history in nursing. I actually graduated with my bachelor's degree from Mount Mercy in 2010, and I also got a master's degree in nursing education to teach. I have worked in several different areas. I've worked in home health care. I have done internships in the emergency department and on a pulmonary unit. I started as a CNA. I did some cardiac stroke nursing here and at another hospital. I did infusion nursing and wound nursing and hyperbaric oxygenation therapy, which is pretty cool. You should look that up. I was also a sexual assault nurse examiner for a while, and now I'm back in the ER. I still work the floor and I get to do all of this teaching. So thank you for listening today. I'm going to tell you a little bit about what it means to be a nurse. I'm going to share my screen and go over to PowerPoint here. All right. So what is a nurse? It seems obvious. I think we've all seen nurses. We've seen what they do. Obviously, they take care of people, right? Well, yeah, in most cases they do, but there's a lot of other things you can do as a nurse. Nursing isn't just bedside nursing. That's very, very important. It'll always be needed, but I think you'll be surprised by all the things you can do as a nurse. So I want to touch on a few of those things. The most known things that we do, we are the eyes and the ears for the doctors. When you go to a doctor's office or when you work in the hospital or you're a patient in the hospital, the doctors will come in and see you for a very brief period of time. And the nurses are there the whole time. They are the eyes and the ears for that doctor. We need to know when things change. We need to notice little changes by doing things like taking your vital signs like blood pressure, heart rate, your temperature and oxygen levels. We give you the medications. We see how you react to the medications. We're always assessing the patient every shift and sometimes multiple times a shift. And then we also get to help the physicians with bedside procedures as well. So one surprising fact, I don't find it that surprising, but I'm a nurse, so I'm a little bit biased, is that nursing is the most trusted profession in the United States for the last 17 years. There was 1 year that we actually were not, and the firefighters were. And if you guess that was the year of 9/11, then you'd be correct. A lot of events happened with the terrorist attack, and people really started to trust firefighters and first responders more, which is great. And those are some of the people that we work very closely with in the ER, which you'll see here in just a little bit as well. So what got me into nursing? Why did I choose nursing? It's a little bit different for everybody. For me, it was my first choice career. I actually never imagined being anything other than a nurse. I grew up with a grandfather that had a lot of complex health issues. He had COPD, some breathing issues, and he was diabetic. He was in and out of the hospital a lot, and I was very close with him, so I would come visit, and I got to see the nurses taking care of not only him, but our entire family that when we came to visit. I work with some other nurses who this is actually a second career for them. One of them started as a boutique owner and she made jewelry, and when she had her baby, she saw nurses taking care of patients and their families, and she thought that might be something that she wanted to do. So that led her into a career of nursing. So where do nurses work? There's a lot of places, actually. The first places you probably think of are the hospital and doctor's offices and clinics. But there are a lot of other places that employ nurses. You'll see the military. You can go into any branch of the armed forces as a nurse. You can work in research labs. that is a career path that would take you away from the bedside. You wouldn't be working directly with patients, but it is very important to our roles at the bedside as well. You see an ambulance and a helicopter here. Nurses work in transport as well, especially those helicopters. We do have helicopters here in Cedar Rapids, and we use the surrounding ones. We get helicopters in here at Mercy. We also send patients out by helicopter. They take very critical patients. And the reason we use them is because we have a lot of rural area, and it can take a long time for one of our ambulances to get there. So it actually cuts the time, the transport time, in half if you send a patient by helicopter to Iowa City from Cedar Rapids rather than by ambulance. Now I have a picture of a cruise ship and a resort here. That may have you wondering why I have a picture of this when we're talking about nursing, but wherever people go, there has to be nurses. There needs to be healthcare as well. So as a nurse, you could make the choice to go work on a cruise ship or at a ski resort and work 3 days a week and enjoy the other 3 with all of the luxuries that come along with it. So vacation spots need nurses as well. Nurses can work anywhere in the world. Just because you went to school here doesn't mean you couldn't choose to move to another country and be a nurse. It's kind of it really is a universal profession. We have nurses from other countries that come work alongside us as well. One other cool thing that you can do is travel nursing. It is a very popular route in nursing, especially if you maybe don't have a family or don't have anything keeping you here. You can take short-term contracts and go anywhere in the world. Say it's winter in Iowa, I want to go to Hawaii. So I'm going to go take an 8-week or 13-week contract there. I'll work 3 days a week, and then I'll go lay on the beach the rest of the time. And then when that 13 weeks is up, I'll come back and be able to see my family, and I can accept another assignment anywhere else whenever I feel like it. I don't have to take them one right after the other. So that is a really awesome part of nursing, being able to see the world, vacation, and it pays a lot of money. So what else can you do with a nursing degree besides the bedside educate or the bedside treatments? We saw a picture of researchers, so we practice based on evidence, and that is ever changing. It is always evolving, and people have to be doing that research to find out what the best practice is. So there is kind of a lingo in healthcare, and sometimes people who work in one area don't understand what the bedside nurses are dealing with. So to have nurses employed in those areas can really help make things connect a little bit easier. Forensics. I talked about how I was a sexual assault nurse examiner for a while. There is nurses that work for like medical examiner offices, police departments, but we get to collect evidence. It's really neat. The hours are quite different than, well, all nursing hours are quite different. You get to work all kinds of different shifts, and you can choose whether you want to work nights, weekends, days, and all of that. But forensic nursing, if you're into all the sci-fi and the criminal logistics, that's a awesome career path to look into. Informatics, if you like computers, you can be a nurse in informatics. We have a lot of them actually, and I know some nurses that have traveled from the bedside route into informatics. So documentation is a huge piece of what we do as nurses as well. Everything that we do is not considered done unless it's actually documented. So there are people that work with the computers that help us to become more efficient and make our charting a little bit easier, because we don't want to spend all of our time documenting when we'd rather be spending it at the bedside as well. Administration, hospitals have to be run by somebody. Nurses are actually always a part of the administration within the hospital as well. Private practice, that would be like your doctor's offices. There's all different specialty clinics as well. There is clinics that deal only with gastrointestinal tract. There are clinics that deal with only the heart or cardiology or pulmonology, which is lungs. So if you find a deep interest in one particular body system, you could choose to go that route as well. Teaching is another one, which is what I went into. I really enjoyed working at the bedside, showing new employees the ropes and teaching them how to do the job. And I also like to be in a classroom and teach people about nursing and different skills. I think it's very interesting to see people pick those new things up or for the light bulb to go on. So teaching is also another route that you can go in nursing. If you do want to work in a hospital, you still have a whole lot of choices there. Um, Once you decide you want to be a bedside nurse, you also need to decide what area. Do you want to work in a birthplace and help deliver babies? Do you want to work in surgery and be in an operating room? Do you want to work with cardiac patients? Do you want to work with patients who have lung problems or gastrointestinal problems? There are a whole lot of choices to make once you decide that you want to become a nurse. So we work with a whole lot of different people. You can't have tunnel vision. You need to see your whole team when you are a nurse, and you need to have good communication with them as well. So some of the people we work with, just to name a few: paramedics, respiratory therapists, doctors, police, chaplains, lab techs, work with radiologists, nurses' aides are very important. We work with the schools, administration, IT departments or computers. We work with prison and jail, environmental services, social workers, and dietitians. We couldn't do what we do without any of these people. So one big question that I always get is, how much does a nurse make? And the pay is actually pretty good. The average starting salary of a nurse in Iowa is between $23 and $27 an hour. And depending on what kind of education you have, what specialty areas, and what experience you have, the pay can get even better. So there are 6 nursing schools in our area: Kirkwood, Mount Mercy University, Purdue, which was Kaplan, the University of Iowa, Coe, and Allen. There are 34 accredited nursing schools in Iowa alone, which you don't need to stay here, but we are one of the top states in the country for education. You can start planning now to go to college, start thinking about what you want to do and what route you want to take, and pay attention to subjects such as math, English, foreign language, science. Science is, I think, the obvious one. Math, we work with a lot of medications and formulas, so you need to be able to work your math with that. It does come into play later on. People are confused often by the foreign language, but even in Iowa, we have a large population of people who speak all different types of languages, some that I didn't even know existed until I worked in the emergency room. We do have translator services, but they work better in some situations than others. We have Marty, which is, if you're familiar with FaceTime or Skype, it's pretty much Skype or FaceTime with a translator, which is really cool, but it doesn't do well if we're decontaminating somebody in a shower. You can't put electronics in a shower. So there are some limitations with that as well, and it helps if you're able to understand or even speak a little bit of a foreign language. Right now, you can take things like CPR and first aid classes. I'm going to talk to you a little bit about something called Stop the Bleed here in a minute. There are classes for that. You can look into becoming a CNA or a tech at a hospital. There are a lot of volunteering positions as well. Just getting in that environment will teach you a lot. So how do you do the education? How do you go into nursing? There's a lot of different educational routes as well. There is an associate's degree, which is an ADN, that is a 2-year degree. There is a BSN, which is what I initially got. That is a 4-year degree. There's a master's degree, which is another 2 additional years, and that you'll start going into more specialties. So I have a master's in nursing education. And then beyond that, there is a doctorate degree. So a DNP is what most people get, which is a doctorate in nursing practice. That's an additional 3 years on top of that. And those nurses actually act as mid-level providers. They can do almost anything a physician can do under their guidance. So that's pretty cool. It gives you a lot of freedom and doing things a doctor gets to do with a little less school. So some career skills, things that are important in nursing. Definitely time management, especially I feel like in the ER. I need to know what I need to do and what's the most efficient way I can get all of this done in a small amount of time. And I'm going to be interrupted, so I can always count on that. Prioritization for the same reasons. Who needs to be seen first? Who's the most critical? Who can wait? Or what tasks do I have that can wait, and which ones need to be done now? communication and collaboration, not only the foreign language, working with a team. You rely on your team very heavily as a nurse. We are like another family here. So we need to be able to communicate well. And not only that, but in situations like codes, codes can go very well, codes can go very poorly. That means when somebody's heart stops. It always boils down to one thing, which is communication as well. Did we communicate well? Then the code went well. If we communicated poorly, then it would be interpreted as things didn't go well, what can we do better next time? You need to be adaptable and be able to think on your feet, because things happen quickly and unexpectedly. You need to have good listening skills as a nurse. You need to be able to analyze and come up with solutions with the information that you're given. You need to be able to have digital fluency or computer skills, because we work with computers all day long and everything we do actually translates back into a computer, even with our medications. You need to have empathy, self-awareness, and social diversity awareness. Sometimes we all have biases, whether we really acknowledge them or not, but being able to take that deep look inside yourself and acknowledge your own beliefs will help you when dealing with somebody who maybe has different beliefs than you. I still have to take care of people who don't agree with me, or maybe we don't have the same religious beliefs. So having that self-awareness really helps you to treat everybody equally. All right, I'm going to go out of the PowerPoint here, and I am going to show you a couple of things on Stop the Bleed. So as a trauma nurse, I frequently deal with uncontrolled bleeding. I also happen to be a Stop the Bleed instructor. I actually go to multiple schools around the area and teach Stop the Bleed, mostly to the teachers every year as an in-service during the summer, but sometimes we do classroom teaching for students as well. So I do want to show you a few things about how to stop uncontrolled bleeding. The first thing you want to do if you notice that somebody is bleeding is make sure and maintain your own safety. The same thing goes when you take a CPR class. You never want to create two patients out of one. So make sure the scene is safe before you ever go into a situation. Then you need to recognize, is this bleeding uncontrolled? Is it just bleeding a little bit, or is it pooling? Is there more than a half can of soda? Is there any squirting or spraying of blood? That would be uncontrolled bleeding. We need to get 911 on the way if that's the case. And then we need to find some kind of first aid kit or supplies. So you might look for a first aid kit near an AED. Usually there's a first aid kit stored right near that. And you'll have some things like gloves or maybe gauze or even a tourniquet in those kits as well. If not, you can try and use what you have. I'm going to show you how to hold pressure here in a minute. If there's not a first aid kit available, you can use any clean cloth, a shirt, a towel, and use that to put direct pressure on a wound. If you have a first aid kit available, then you can determine whether or not you will use a tourniquet or direct pressure. I'm going to pull out my tools here. So I have a couple wounds here. These are simulated wounds. They are deep. So if you are going to do direct pressure on a wound, you will take your gauze or material and you actually need to pack it in the wound until it is full. Then you're going to put it over the top and hold very tight pressure over the top, and you don't stop. If the wound is on an arm or a leg and you have a tourniquet, that can be another option. This is called a cat tourniquet. We use these in the emergency department. They use them in the military also. So it has Velcro. And if the bleeding, let's say, was on the arm, you put the tourniquet 3 to 4 inches above the bleeding and tighten the Velcro. And then this windlass here, you turn and turn and turn it until you cannot turn anymore or the bleeding has stopped. It's essentially cutting off the circulation, stopping that bleeding from going down the arm. And then this stays on until a first responder comes. You don't take this off. You don't want to peek to see if it's still actually bleeding or not. So these are life-saving things. In situations like mass shootings, they actually came together and determined that almost 50% of the people that died could have been saved if somebody just stopped bleeding. And unfortunately, this is something that we have to talk about a lot in today's society. It's scary to talk about, but it is real. And just those simple things that I showed you can help you to save a life, along with taking like CPR classes as well. So I hope that you enjoyed hearing about the nursing career, and hopefully I get to see some of you in the future. Thanks for listening.